You are officially invited. Yes, you. You're invited to join us in Fertility Awareness Mastery. This is my 10-week group program designed to help you gain confidence using fertility awareness. Whether you're actively avoiding pregnancy or looking to optimize your chances of conception, either now or in the near future, we have a spot for you. We start in January. Are you ready to jump in? Head over to fertilityfriday.com/group program to register today. That's fertilityfriday.com/group program. This is the Fertility Friday podcast, episode number 288. Welcome to the Fertility Friday podcast, your source for information about the fertility awareness method and all things fertility. I'm your host, Lisa Hendrickson-Jack. I'm the author of The Fifth Vital Sign and the Fertility Awareness Mastery Charting Journal. I'm a certified fertility awareness educator and holistic reproductive health practitioner with nearly 20 years of experience teaching women to connect to their fifth vital sign through menstrual cycle charting, balancing hormonal health, and optimizing the menstrual cycle without hormones. I'm outspoken about hormonal birth control and its impact on fertility and overall health because you have the right to know how your body works and how artificial hormones disrupt that natural process. I host live coaching programs to help you achieve optimal fertility and health because it's important to have healthy menstrual cycles regardless of whether or not you want to have babies. I'm also a wife and mother of 2 beautiful boys. I know, I'm a busy girl, but I managed to fit it all in. This podcast is designed to empower you to take full control of your cycles, your fertility, and your overall health. And I'm so excited that you're here with us today. Today's episode is all about thyroid, and thyroid is so crucial for optimal fertility, menstrual cycle health, hormone balance. I'm really excited to welcome both Dr. Eric Balcavage and Dr. Erica Riggleman of the Thyroid Answers Podcast to the show to talk all about thyroid. I found this interview to be extremely informative and just really helps us to get to the root and better understand thyroid function. So without further ado, let's jump into today's episode. And I'm excited to introduce 2 guests to the show today, Dr. Eric Balcavage and Dr. Erica Riggleman. It's always fun to have 2 guests on the show. I'll introduce them each separately and then give them an opportunity to share a bit about what brought them into their work afterwards. Dr. Eric is the owner and founder of Rejuvagen, a functional and regenerative medicine clinic in Glen Mills, PA, and he is the co-host with Dr. Erica of the Thyroid Answers Podcast. Dr. Balcavage is a certified nutrition specialist, a certified functional medicine practitioner, board certified in integrative medicine, along with being a licensed chiropractor in Pennsylvania. And Dr. Erica graduated from Logan College in Chesterfield, Missouri, with a Doctor of Chiropractic degree, as well as a master's in nutrition and human performance. She specializes in functional medicine and is the graduate of the American Functional Neurology Institute. And in today's episode, we're focusing on the thyroid, how the thyroid affects fertility, why this condition is often underdiagnosed in women, and the specifics of why it can be difficult to identify at times, especially when the lab results don't match the symptoms. So without further ado, welcome to the show, Dr. Eric and Dr. Erica.
Yeah, awesome. Thank you for having us.
Well, I'm really excited for this interview. We first connected when you interviewed for your podcast, and as we were talking about all the cycle and thyroid, I just knew I had to have you on the show because I really, really appreciate that the way that you break down thyroid and really help women to address this condition. So I'd love just to take a quick moment for each of you just to share with us a little bit about what brought you to functional medicine and the work that you do, but particularly focusing on thyroid health.
You want to go first, Erica? You want me to go?
Yeah, no, I can go. So a lot of, being traditionally in the chiropractic realm after graduation, you find that patients often adjusting them, they weren't getting to where they want to be, and they had all these chronic health issues. And it was the seeking of the why are they still having these issues? There's got to be deeper rooted issues. And obviously I already had a background in nutrition, so that kind of led me down the whole functional medicine, nutritional route. And it's kind of like a rabbit hole. The further you get into this, the more you realize that there's so much out there. And really after connecting with Dr. Eric, several occasions and seminars and things like that, become more focused in on the thyroid. And we found in the realm of thyroid, there isn't a lot of talk about, cellular hypothyroidism and things that we were doing in our practice. And so we came up with a podcast to really kind of get the word out there and really kind of special in on how we view the thyroid. And it's really been eye-opening seeing the people that we can help and reach and touch through the podcast. But, I've continued to see people in our practices. In my practice, we do functional medicine, regenerative medicine, and it really ties, the whole functional medicine route really ties well into helping people heal.
Mm-hmm. Thank you. And Dr. Eric?
Yeah, I got into this by accident, really. I wound up needing to learn more about functional medicine and thyroid physiology just due to a family member who was diagnosed with hypothyroidism. And in the process of digging into it and attending seminars and then talking to my chiropractic patient base, you start to realize how many people have chronic hypothyroid symptoms. They're told that they don't have a thyroid problem, and how many people who are taking thyroid medications still don't feel well. They become euthyroid. Their thyroid medication normalizes TSH and T4, but they still have chronic hypothyroid symptoms. So that became a thing that I started really working on in my practice and helping those people. And then, as Erica said, we practice, we have very similar practices, and we've been friends for a while. And I just said, we need to do something that's different, because I think even in our functional medicine space, a lot of the attention goes to the gland and Hashimoto's. And I think a lot of what's missed is really what's happening inside the cells. So we started the Thyroid Answers podcast so that we could get more of that message out there to people.
Mm-hmm. Well, let's get into it. One of the reasons why I'm really thrilled to be able to talk to you about thyroid health is because it's similar to what both of you kind of described. So when I'm working with someone, helping them to learn to chart their cycles and understand how their menstrual cycle relates to their health, you can think of them, I think Laura Bryden always says, like, your period is it's like your monthly report card. But when you're charting your cycles, you have this actual chart. Women are often paying more attention to their bodily signs and symptoms. And so I've seen it time and time again where you have these quote unquote normal labs, but you can see that the menstrual cycle is not falling into the normal range. You can see that the temperatures are not where they need to be. So even it's exactly what you're describing. Many women have the situation where their labs are quote unquote normal. Their doctors are satisfied that the thyroid is perfectly fine, but they are not feeling fine. So I'd love to just jump right in. Could you talk to us a little bit about the difference between cellular and glandular hypothyroidism? Because I really haven't heard it described in that particular way until I heard you talk about it that way.
Yeah.
You can go ahead, Eric. You can go ahead and take that.
So when we think about hypothyroidism, everybody's focuses on the gland. And the gland makes thyroid hormones. The thyroid hormone has to leave the gland, get into the bloodstream. And then thyroid hormone does the vast majority of its function inside your peripheral cells, inside the cells in your body. And for what we call the genomic actions, the main actions we think about metabolism, T3, which is the active hormone made by the thyroid gland, has to get to the nuclear receptor to stimulate metabolism, okay? So glandular hypothyroidism is a damage to the gland where the gland is either become diseased, but it's just not making enough thyroid hormone. Cellular hypothyroidism is a state where the gland is making sufficient thyroid hormone. There's enough thyroid hormone in the blood, but insufficient levels of T3 are reaching the nuclear receptor. And you can have cellular hypothyroidism with a perfectly normally functioning thyroid gland and normal blood values. If you have glandular hypothyroidism where the gland's not making enough, then you're definitely going to have cellular hypothyroidism as well. But the mistake is that the glandular process happens first, and then you develop cellular hypothyroidism, and that's not the case in most situations. In most situations, people are developing cellular hypothyroidism for maybe weeks, months, or years before they actually see overt changes in the gland.
Well, so I just want to kind of hang out there for a minute, because I feel that this is a really, just of all the years I've been podcasting, the way that you've described it, it makes so much sense, and it can really help people understand what's going on. So from my understanding, what you're saying is that it's possible to have your thyroid making enough hormone, but the hormone is not getting into the cell. And that's how you defined cellular hypothyroidism, versus having an actual issue with the gland, meaning that the gland is not producing enough. And obviously, if the gland is not even producing enough, you're not going to get enough in the cells. Is that correct?
Yeah, that's correct. And the other piece of that is you might still get thyroid hormone into the cell, but once it gets into the cell has the ability to either activate T4, which is the primary hormone, to T3, or deactivate it into a product called reverse T3. But nobody measures reverse T3 in the allopathic model. So if you don't measure it, you can't manage it, and it doesn't exist. But cells control what happens to the hormone once it gets inside the cell. So if a cell is trying to slow its metabolism down, it's going to deactivate the thyroid hormone. If it's trying to increase the metabolism of the cell, it's going to convert it to T3 and get it to the nucleus. And the significance of that it can't be understated, because the cells have to have, and the tissues have to have, self-control of thyroid physiology. And the reason for that is if it was the gland that really controlled the physiology in totality, then anytime thyroid hormone dumped out of the gland and into the bloodstream, all your tissues would upregulate the metabolism at the same time. And we don't want that. You want your pancreas metabolism upregulated at one point, you want your brain upregulated, you want your heart upregulated, you want your GI tract upregulated differently. And so if we totally relied on what the thyroid gland made and what it dumped into the bloodstream, and we didn't have individual tissue control, then when you were, let's say, being chased by a tiger, your bowels would be moving, you'd be digesting food, you'd be doing a whole bunch of things in your body all at the same time, because the thyroid hormone is being upregulated. We don't want that. The tissues have individual control to be able to upregulate or downregulate independent of what the thyroid gland is doing, and to some degree independent of what's in the bloodstream.
Mm-hmm. Well, and so a little tongue-in-cheek, but it sounds like what you're saying is that our bodies are extremely complex and much more intelligent than we give credit for. And our individual cells and organ systems have the ability to adjust the thyroid uptake and all of that. Obviously, I'm not saying it in the most scientific terms, but in order to adjust accordingly to the situation. So talk to us a little bit then about kind of on a broader level. So first of all, how is it even possible then that you could be making enough thyroid hormone and it not really getting to where it needs to go? Like, what's happening in the body to prevent that? And why are your cells basically, like, why is it happening that they're not utilizing it? And also, how on earth could you identify that with labs if you're saying the levels are normal?
I think that the biggest thing that's really causing that is going to be the cellular resistance that we're talking about. The cells become resistant where you're not getting that transport. It's kind of like when people become insulin resistant, they can't get the insulin inside the cell. And so there's a multitude of factors that play a role in cellular resistance for thyroid hormone. I would say probably one of the biggest ones that play a role is going to be inflammatory levels. How much inflammation do we have going on in the body that's going to downregulate that? The thyroid hormone really is the gas pedal. It's meant to go in most instances. And so if we've got something going on like inflammation, I think of like a fire. There's a siren going off. There's something that the body is saying, hey, whoa, that's really trying to push the brake. And so by the quickest way you can slow down the accelerator is to push the brake, and really that's really trying to shut the thyroid hormone system down. It's again, it goes back to what you said, the body is smart, and it's almost like a protective mechanism to try to shut that down so we can get, whether it's healing going on, or maybe there's an active infection, there's some sort of stressor going on in the body. And so there's something at that level, and we often see that it's inflammatory based. And in our society, there's people have inflammation running rampant from whether it's the foods we eat, the toxins we're exposed to, the stressors in our life. All of those things can promote inflammation. And that's probably the number one thing that's contributing to that cellular resistance.
Mm-hmm. I'm just pausing in case you have anything to add, Dr. Eric.
Yeah, well, I think Erica said that great. I mean, there's typically some type of danger response going on at the cellular level, or the cells and the tissues that those cells are in are getting the signal that, hey, we need to slow metabolism down, and inflammation is definitely at the key. And so I think the second part of your question, which Erica didn't answer, is how do we evaluate it, right? And that's a little bit more complex. There's really two models of how to evaluate thyroid physiology. And the allopathic model, which is what most people are used to, is you go to your medical doctor, you go to your endocrinologist, you have hypothyroid symptoms, or maybe in the case of your listeners, they're struggling with fertility issues, right? And so they go to their medical doctor, and typically what's done in allopathic medicine is what's called a TSH with reflex to T4. And so if TSH, which is thyroid stimulating hormone, is thought in allopathic medicine to be like the be-all, end-all marker of thyroid function and physiology in the body. If that's within the normal lab range, then no further testing is done. And so if it's normal, you don't have a thyroid problem, and no further testing's done, and your doctor says, hey, you don't have a thyroid condition. If your TSH is out of range, then it'll reflex, which means it automatically a T4 test is ordered, and then T4 is tested. If T4 is below lab range, then you're going to be diagnosed as hypothyroid. But if TSH is normal, then you're going to be diagnosed as euthyroid or normal. The biggest problem with that model is we're using a test that doesn't really assess thyroid physiology in the whole body. What it's really doing is just giving us the impact of what's happening maybe in the brain, the pituitary, and the thyroid gland. But it's not really a great marker even for that, because based on what we know, inflammation, which is the number one chronic condition we have, is chronic low-grade inflammation. Inflammation can actually suppress TSH production, making TSH actually appear normal when somebody's actually hypothyroid. So if they didn't have the inflammation, their TSH might be elevated, but because inflammation suppresses TSH, it'll appear normal, or in maybe even a worse case, it'll actually be below, closer to the lower range of the hyperthyroid state, and the doctor will say, you definitely don't have a hypothyroid condition, you're more hyperthyroid. And the patient's sitting there with dry skin, thinning hair, gaining weight, and saying, these are all hypothyroid symptoms, how can I be hyperthyroid? And they'll be told, hey, you need to eat less, exercise more, you're just stressed out. So it's not a very efficient model. The other part is that by the time TSH rises above the lab range, almost 90% of the thyroid gland can be destroyed by that time. So it's not an early marker of thyroid gland dysfunction at all. It's really a late stage marker of thyroid gland dysfunction.
Yeah, and I think a lot of patients who come in to see me who their TSH hasn't even elevated yet, haven't gotten to glandular hypothyroidism yet, you ask them, how long have you been suffering with these hypothyroid symptoms? And they'll usually say, well, if I really thought about it, maybe 5 years, 10 years, maybe even longer than that. And I think that people sit with cellular hypothyroidism, they sit kind of in this gray area where their doctor keeps telling them they're normal, but they have all these symptoms. And I think that part of identifying cellular hypothyroidism, yes, is looking at more extensive labs, but also listening to what's going on. Having those symptoms is your body's way of saying that something's not right. And there's a reason why it's happening. It's not just in your head. If you're gaining weight, your hair is thinning, your skin is really dry, you're constipated, there's obviously something going on with the thyroid function that we have to look at and dig a little bit deeper. So running full thyroid panels, looking at inflammatory levels, but then listening to the patient who is sitting in front of you saying, hey, I've got all these symptoms, I think is really, really key for evaluating a patient.
Well, and it's interesting because my mind is like, listen to your patients and take what they're saying seriously. But unfortunately, that's where we're at.
Can I piggyback on that real quick?
Sure.
So I think one of the key things is that, and what Eric is saying is, hey, the patients, we have to listen to our patients. And that the big part of that is then looking at lab panels and determining, we have to consider the fact that lab ranges that your medical doctors use are not health ranges. Those are disease ranges. And so by the time you're out of the lab range, you're in the sickest 99, 97% of the population getting tested. So that's not the health range. The health range, or what we call the optimal or functional range, is a much narrower range. So that's part one. Part two is that we have to get away from reading labs and lab reports like if there's an H or an L, then there's a problem. Any monkey can read an H or an L on a lab report. What we need to be doing as doctors is actually interpreting lab reports based on what our patients are telling us, because a lab value could be normal but inappropriate for our patient. And so if, as Erica was saying, if they're coming in, they're tired, they're fatigued, they're infertile, they have heavy menstrual cycles, their skin's dry, they're gaining weight, we have to take that into consideration and then look at our patient's lab values and say, listen, she has all the symptoms of hypothyroidism, but her TSH is in normal range. So that range, even though it's normal, may not be appropriate given what my patient is actually telling me. So now, especially in functional medicine, we would say, okay, let's look at the whole panel and let's look at key inflammatory markers that may then show us that, hey, that TSH value, even though it's normal, is inappropriately normal because I have a patient with chronic hypothyroid symptoms, and if I have a patient who's got multiple inflammatory markers on their lab work, so now that TSH value is inappropriately normal. Does that make sense?
It does. And I appreciate I appreciate you expanding on that because of course you could tell the tongue-in-cheek nature of my comment, but for all of the practitioners who are listening, because they do and they are, it makes a lot of sense because it's what you're saying. It's like the difference between just looking at the numbers and taking it for what it is versus looking at it within the context of the actual person that you're working with and what it means for them. There's something else I just wanted to touch on because the way that both of you have described thyroid dysfunction within the context of overall health. So it's just a different way of looking at illness. I feel like a lot of us, if we were diagnosed with a thyroid issue or thought we might have a thyroid issue, it's like you feel like your body is broken and there's something wrong with your thyroid. But the way you described it was that if you have an underlying issue, such as inflammation, or if you're dealing with stress or something that is causing basically your body to want to kind of put the brakes on the metabolism, the way that you described it sounds like your body is essentially protecting you. Like this is by slowing down your metabolism, by doing all of these things that kind of manifest themselves in thyroid dysfunction, it's like your body is trying to actually help you. Did you want to touch on that a little bit? Because it's a very different way of looking at illness.
Yeah, I think when it comes down to what's going on in the body, we have to look at the body. The body doesn't make that many mistakes. Most of what the cells do is for protective purposes, right? So they're either in energy production or they're in protection mode. And so what we have to do when we look at somebody who's got hypothyroidism is to take a step back and say, why is this happening? Not, oh, the system just became dysfunctional, right? And now we just need to put more stuff in it. I mean, that's what we typically do, especially in the allopathic model. And I'm not blaming that model. That is the model because they're typically working in a disease state. But even when we're talking about your listeners, right, who are struggling with fertility issues, we have to step back and say, okay, I'm having a hard time getting pregnant, or my cycles are abnormal. There must be a reason for that. And we shouldn't be trying to force a pregnancy into somebody who's not able to maintain normal cycles or not able to get pregnant. We have to take a step back and say, why is the body not allowing somebody to get pregnant? Or why is this tissue becoming insulin resistant? Or why is the tissue becoming thyroid resistant. There's a reason for it, and it's usually a protective mechanism, not just that the body became dysfunctional. That model, it just doesn't make sense. Even when we look at insulin resistance and diabetes, we should be asking, why is the cells becoming insulin resistant? And to be healthy overall, you have to have healthy cellular function first. You don't have healthy cell function, you don't have healthy tissue function. If you don't have healthy tissue function, then eventually you're going to have a dysfunctional physiology overall.
Yeah, I think that's really important. I think that's a great tie-in, especially given this podcast, is that people are often, when you get diagnosed with a thyroid issue, you feel like your body is broken, or if you can't conceive that something is broken. But again, you have to ask the question of, well, why is that happening? And there is the protective mechanism. And so asking the right questions, whether it is thyroid related or we're dealing with fertility issues, I think that that's an important factor, is that there's the mindset behind it. It's that it's not that you're broken. It's that something's not working optimally in your body, and let's optimize it. Let's figure it out. Let's get to the root cause of it, and we can address this. Unless there's like something physical going on in the body that's preventing obviously fertility issues, there's obviously something at a cellular level. Just like thyroid hormone, your sex hormones have to get into the cells. They have a function. And so you can see this across the board, is that your cell health is really, really important to overall function in the body.
Mm-hmm. Well, I'd love to talk a little bit about infertility. So for the women who are listening to the podcast who are kind of well-versed in fertility awareness, and maybe some of them who've been tracking cycles for a while, some of the ways, and these aren't the only ways, but some of the ways, and you touched on a few of them as well, but some of the ways that hypothyroid shows up in the menstrual cycle include, in some cases, a lower basal body temperature, which is kind of a more obvious thing when you're charting. When your temperatures are what I like to call off the chart on the woman, but some women who take their temperatures every day. So for example, I just released a charting workbook, and there's a limit. I didn't make it so that I made it so that it would handle sort of suboptimal temperatures, but if the temperatures are off the chart, they're literally off the chart. So for instance, like under 97.0 temperature every morning, or under, I think it's 36.0 temperature every morning. There are women who take their temperature every single day and it's really, really low all the time. But that's not the only way. You mentioned heavy periods, irregular cycles. Some women might find that they have very limited mucus production or signs of low hormones on their chart. Could you talk a little bit about how thyroid issues impact fertility? And there's just something I wanted to say, because I think in my Facebook group, even a couple days ago, a woman posted something to the effect of, my TSH is I think maybe too high. What can I do to lower my TSH so I can get pregnant? So that we have that established, that when people think about the thyroid issue, it's literally like, what can I take to make the numbers better so that I can get pregnant?
Right. Well, I guess I'll jump in here. So without appropriate thyroid physiology, in the developmental tissues, it's going to be nearly impossible for somebody to get pregnant. So when we talk about thyroid hormone at the cellular level, to get pregnant, to produce eggs appropriately, to have the right environment for development, you have to have appropriate levels of cellular thyroid and in hitting that nuclear receptor for mom, for baby. So it's critically important. From a glandular perspective, if the gland has become dysfunctional and you're trying to get pregnant, at that point in time, just normalizing TSH with T4 hormone can normalize TSH and T4, but it doesn't mean you're going to normalize what's happening at the cell. And I think that's a misconception many times, that people say, well, hey, you're having a hard time getting pregnant, you're hypothyroid, we're going to give you thyroid hormone, and then you should be able to get pregnant. And I see it in my practice, and I know Erica probably sees it in hers as well, is we have those patients, they get their thyroid values to a euthyroid state, a normal state, and yet they still struggle, because really what's happening is that thyroid hormone isn't getting into those cells and tissues that are critical to development, and they still can't get pregnant. So now, what's the next scenario is, hey, let's just load them with hormones to try and force a pregnancy. And I think it's one of the worst things we can do from the perspective of mom's health and baby's potential health, because the body is trying to tell us that, hey, we're not healthy enough right now to bring a new being into this body. We're struggling to maintain the health of the mother. Getting pregnant and trying to maintain a pregnancy is not where the physiology of the body is right now.
Yeah, and to piggy off back what you said about the person on your Facebook group, I think it's in our society, we're led to believe that, well, just tell me the pill, or tell me the supplement I need to take, or the one thing. We always want it now. And it's one, not that simple. And two, to correct a lot of these things, it requires changes lifestyle wise, maybe the foods you're eating. And some people just look at that as being too hard, and they just want that, just give me that one thing, give me that one supplement. And so it's not that easy. And if it was, it would be very common knowledge and everybody would know, but we know in life it's just not that simple to correct these things. And it doesn't have to be super complicated, but it does take a little bit of work when you're trying to, one, find the underlying problem. And I think that's really important. Find out, why are you having these things? And then often those things, a few tweaks here and there might be very, very simple to get you back on track.
Well, I wanted to ask about, I think we touched on this a little bit, but for the listener who's now curious, you're describing my exact situation. I have these symptoms, my thyroid labs, I'm being told it's normal, but I have this sense that there's something wrong. What is the difference then between your typical, I think that we went through this, but I'll just ask the question, the difference between the labs that you'll get from your regular doctor. I think you went through, I think Dr. Eric actually went through what your typical labs would look like, but what would a functional lab workup look like? So what are the tests that your functional doctor is doing that your, regular allopathic doctor is not? And also, could you talk a little bit more about T3 and reverse T3 and why that would be an important part of a functional lab work? And then perhaps why it's not something that's done in traditional allopathic lab work.
You want me to go, Erica?
Yeah, go ahead.
So when we're talking about, I think the first part of the question was when we're talking about a functional thyroid, functional medicine thyroid assessment, we definitely need to look at more than TSH and T4. We also want to look at T3. We want to look at the free hormones to find out how much available is actually able to get into the cell. We want to take a look at reverse T3 uptake, which is a proxy of how much thyroid hormone is available or how much thyroid hormone is bound to the carrier molecules. You can take a look at thyroid binding globulin, we can take a look at thyroid antibodies, and then we can look at what we call T3 to reverse T3 or free T3 to reverse T3 ratios. It's important to note that thyroid hormone in the blood is great, but if you have low levels of free hormone, it's only free hormone that can actually get into the cell. It has to come off those binding globulins, those transport proteins, to actually get into the cell. So that's really important. When we're assessing thyroid physiology from a functional standpoint, we want to look at what the T3 ratio is in relationship to free T3 and why that's important. Because the vast majority of thyroid hormone that's made by the thyroid gland is T4. And T4, I think 90% of the thyroid hormone that the gland makes is T4. Only a small percentage of T3 is made by the gland. It's really around 10%. And so T4 is a prohormone. It's really not quite ready for action, okay? So it has to be converted inside the cells to T3. And so we want to see what the cell is favoring. Is the cell favoring the conversion of T3, which is going to stimulate metabolism, or is it going to be converted or deactivated to reverse T3, which doesn't bind to the receptor and doesn't stimulate metabolism? So it's really important. What does the cell favor? And really, we don't have a great direct measurement of what's going on in the cell. So we have to use proxies. We have to look at T3 to reverse T3 ratios, and we can look at reverse T3. Now, the problem is, if you just look at reverse T3 and you say, well, it's normal, then therefore you don't have a cellular hypothyroid state. We can't take that at face value, because if the T4 levels are low in the blood, then you're going to have lower levels of reverse T3 because there's not enough T4 to necessarily convert to reverse T3. So we want to look at the ratio. So we look at T3, total T3, divide that by reverse T3. That number in optimal cellular health should be greater than 10. And if we take free T3 and divide that by reverse T3, the optimal ratio of that should be greater than 0.20. And so if the person has elevated reverse T3, then we can say, hey, you got the cellular hypothyroidism going on. Or if those one or both of those ratios are low, then we have cellular hypothyroidism going on.
And the other talk to us, just what is reverse T3 for the person who's listening who's like, what the heck is he talking about?
So reverse T3 is the deactivated form of T4. So T4 can either get activated to T3 or it can be deactivated to reverse T3. And reverse T3 doesn't stimulate the metabolism. It doesn't bind to the nuclear receptors that stimulate metabolism. So it's really important to know those values. There is a lot of discussion in the functional medicine world where that reverse T3 actually binds to the nuclear receptors and blocks metabolism, and that actually doesn't occur. It can bind to receptors on the outside of the cell, but it doesn't bind to receptors at the nuclear level. So a lot of people have said, hey, your reverse T3 is high, we'll just give you T3, that'll lower your reverse T3 and fix your metabolism, and that is not scientifically correct. So that's just a little side note.
I think it's also important, besides just thyroid values going along with cellular hypothyroidism, I think it's also important to include in that lab work is going to be inflammatory markers, maybe looking at some ferritin levels, C-reactive protein, homocysteine, vitamin D levels, kind of running a comprehensive metabolic panel so that you can get a full picture of what the metabolic state is doing. Do we have blood sugar issues? Do we have liver enzymes that are high or inflammatory markers? So I think that in combination of a comprehensive thyroid panel, also running a metabolic panel, I think is really, really key to looking at cellular hypothyroidism.
I wanted to jump into today's episode to invite you to join us for the next round of Fertility Awareness Mastery, my 10-week group coaching program designed to help you unlock the secrets of your menstrual cycle. Fertility Awareness Mastery teaches you everything you need to know about using fertility awareness cycle tracking to achieve your intentions. Whether you're currently trying to get pregnant, avoiding pregnancy, or planning to conceive in the future, we've got you covered. This program goes deep. Get to the root of your period problems, hormone imbalances, fertility challenges, and so much more. Early bird registration is now open for a limited time. Make sure to head over to fertilityfriday.com/group program to register today. That's fertilityfriday.com/group program. Now let's jump back into today's episode. Well, and so the listeners are, I'm always thinking from their perspective, and I'm sure what they're wanting to know now after we've kind of taken them on this journey and, looking at thyroid in a different way, what can we do to improve it? When you think of illness or even the thyroid markers, like these markers of dysfunction that we're talking about as being a response to something, an inflammatory state in the body or stress or some sort of other factor that the body's responding to, then it really changes it from taking X supplement. So what are some of the ways that we can actually improve thyroid function?
I think it's not sexy, but it comes down to lifestyle. Diet and lifestyle, it really is what is the key factors that it comes down to. And unfortunately, those things don't come in a bottle, right? Because those things are many times much easier than changing your diet or lifestyle. But, what we try to impress upon our listeners and our patients is, hey, one of the first things to do when you're struggling with chronic hypothyroid symptoms is take a step back and look at your diet and lifestyle. And so you can quickly start to go through a couple key factors. And I call them fitness factors, but look at your diet. What's your diet composed of? Is it composed primarily of whole foods, or is your diet primarily processed foods? We know that processed foods have a greater probability of creating chronic inflammation in the body. And if you're creating chronic inflammation, as Dr. Erica said, then you get deactivation of your thyroid hormone. You can take a look at sleep. Do you sleep 7 to 8 hours uninterrupted straight through the night? If you don't, lack of quality and quantity of sleep is a cell stressor, and that will trigger inflammation and thyroid hormone deactivation. You take a look at breathing. If you're a poor breather and you're a mouth breather, especially at night, you're creating hypoxia, and hypoxia will create inflammation, which will then cause deactivation of thyroid hormone. You talked about emotional stress, and if you have a lot of emotional stressors going on in your life, then that too can trigger inflammation in the body. And we think about emotional stuff, I think we understand danger, right? Danger is, hey, something's going to happen. We understand fear. Fear is the concern that something's going to injure us. And then we have anxiety, which is the perception of danger that may or may not be real. And so when people have a lot of emotional stress, anxiousness, anxiety, fear, or real danger, that's going to trigger inflammatory mechanisms that are going to change thyroid physiology. We then look at things like physical fitness. Are you a person who doesn't get much in the way of physical exercise? That can play a massive role in producing inflammation. And then the reverse is true as well, as you might see with some of your athletes who are endurance athletes or fitness, really intense fitness people. They may be working so hard and not allowing for appropriate recovery that they're chronically inflamed, and that's disrupting thyroid physiology. And then definitely there's environmental toxicity, which can in fact impact both the gland and the cells. There's those things are endless. Like from Dr. Eric was saying about the things we eat, the things we drink. I mean, all you have to do is look at your water supply. What's in your water? And I think most people are told, hey, you got to drink plenty of water, and they do. But where are they getting that water from? Are they drinking it out of plastic water bottles, which are loaded with endocrine disrupting chemicals? Are they getting it from their tap water, which is, if people go to ewg.org and put their zip code in their tap water resource, I think you'd be amazed at how many chemicals are in your tap water that are endocrine disrupting chemicals, things that can shut down thyroid physiology, especially some of the disinfecting agents that are in the water supply that just disrupt endocrine physiology. And yet nobody's paying much attention to those things. We know that there's chemicals in our foods like glyphosate and just environmental toxins, EMFs, Wi-Fi. All these things can disrupt the cell physiology, put our cells in a state of danger, trigger that thyroid hormone deactivation cellularly, and cause somebody to really struggle.
Yeah, I think that it's all about reducing your overall toxic load, because we live in a toxic environment, a toxic world. You're never going to be perfect. I think it's trying to do your best and work on the things that you have the most control over. And so the foods, the stuff in our environment, you have control over those things. And so you're not going to be perfect, but making better decisions, I think is good for reducing that overall toxic load, because your body can handle it to a certain degree. It's built up over 5, 10, 15 years of you being exposed and having these lifestyle factors that your body just can't accommodate anymore. It probably did a really good job for the first 5 to 10 years, and then it just kind of stuff starts to break. It can't accommodate anymore. And it has to, if you have electricity running to your house and it only can do a few rooms, you got to start turning lights off. And that's really what the body does, is it says, I've got to conserve energy and I'm going to devote it to this or this. And when you start to look at your environment, look at that toxic load and start removing the overall fill, I think that can make a big impact in kind of turning the ship around and moving you back towards optimal health and optimal cell health.
Mm-hmm. I mean, it's so interesting because the changes that you've talked about and that you've taken us through are so crucial to maintaining optimal thyroid function, but it doesn't have the same effect as taking something every day. You kind of wonder, how am I going to track the progress? How am I going to know if it's working? I mean, for the women who are listening who are tracking their cycles, that's one of the great things about cycle tracking, because you can then actually see progress. Like as you make these types of changes, you can actually see improvements in your cycle, especially if you had certain issues with your cycle. But I completely agree. It's not sexy, and it's not as easy as just saying, okay, just take this supplement or take that supplement.
Yeah, I wish there was a magic supplement for everything. And even though it's marketed that there's a magic supplement to fix your thyroid, to fix your fertility, to fix your gut, to fix all these things, the reality is those things at best are patches or temporary. If you don't fix the fundamental things in your health that make up your health, these fitness factors, if you don't improve those things, everything's a Band-Aid. And we know this, whether it's medicine or supplements, the same treatment doesn't work for everybody for an extended period of time. And after a while, even the magic supplement or the magic medication doesn't pan out. I mean, you wind up taking another supplement to try and fix it even better, or a second medication to try and force the chemistry. And it just doesn't work. But I get it. I mean, Erica gets it. I get it. You get it. Making changes to diet and lifestyle seems like it's too difficult, but really it is the simplest thing. Not easy, but the simplest thing to do to start to restore your health and your fertility is to say, all right, what is creating this stress or danger burden in my life? And you're never, patients kind of snicker at me when I say, hey, we got to reduce the stress load or the danger load somehow. How am I going to get rid of all my stress? I'm married, I have kids, I have a job, I have finances, I have worry. All those things are true and they're real. Many times it's our perception of those things that create greater anxiousness or anxiety that create our problem. Or they're things that we just take for granted we can't change and don't. And we look at it sometimes like it's this massive undertaking, but in reality, if you just chip away at those things slowly and steadily, you can make huge changes in what's creating your cell danger and your cell stress. Really simple changes made a day at a time, a week at a time, can have a monumental impact on your cellular health and your cellular physiology. And it can be the thing that then leads you to become pregnant with much greater ease and without a lot of hormones that to try and force a pregnancy.
Mm-hmm. So I don't know who said it, but that concept of you can't out supplement sleep and a crappy diet, I mean, that couldn't apply more obviously here. One of the questions I wanted to ask is, there's some women who have all the means and access to, amazing functional practitioners who specialize in thyroid health, who already got everything that we talked about today and are more than willing to support you in achieving optimal thyroid health and addressing all of these issues. For women who are trying to work with their medical doctors, for women who may not have yet found a functional practitioner or who may not actually have the means to seek it out, what advice would you give to them? Because I think that's one of the biggest challenges for women facing thyroid issues, not having the support that they need from their doctors or their practitioners.
I think the biggest thing that you can do is that, honestly, for the most part, is free, is to start working on those factors we just talked about. Those are things you can do on your own. You can find a lot of the information on food, eating an anti-inflammatory diet, an AIP type of diet. You can find all of that stuff for free online. You can find recipe booklets and even just mindset. Even if you just were trying to reduce overall stress and you decided to meditate, I think that, and we encourage all of even our listeners on our podcast is, you don't have to jump to a functional medicine practitioner at the beginning. Try all the things that essentially are free. And if you still don't feel like you're getting to where you want to be, then that's where you want to seek out somebody. But try all the things that we talked about, work on those, the sleep, the food, the stress. Those things can all be done. It's more of just mind over matter, getting yourself to actually make those changes before you actually have to dip into your pocket and spend money on expensive tests or, practitioners and things like that. I think so. Starting with those foundational things, I think is going to be big.
Yeah. I totally agree with what Erica said. I mean, you don't really need a healthcare professional to tell you how to eat healthier, right? I mean, it's easy to find those things. You can do just a self-assessment. Do I sleep 7 to 8 hours uninterrupted at night? I don't. I have a hard time going to sleep. I have a hard time staying asleep. So what can I take that doesn't involve, what can I do to change that, right? Should I Am I on my cell phone till right before bed? That's disrupting my sleep. Am I doing things in the evening before bedtime that's disrupting my sleep? Am I sleeping in an environment that's not healthy? Am I sleeping on a mattress and a pillow that's toxic? Do I have my cell phone right next to my head, which is emitting EMFs? Is my Wi-Fi on at night that may be disrupting my sleep? Those are things you can easily turn off. Get those things out of the bedroom. Don't be on your iPhone or computer for the last 2 hours or so before you go to bed. There's lots of simple tools that you can do to change that. If you're a mouth breather and somebody says you snore or you wake up with your mouth dry or you have cavity issues, you're probably a mouth breather. So there's simple, look up how to become a non-mouth breather, mouth taping, breathing exercises. If you know you're emotionally stressed, or if you don't know you're emotionally stressed, there's tools out there like HRV that can help somebody realize, hey, where is my heart rate variability? And a heart rate variability is an indication of sympathetic or parasympathetic dominance. And if you have a low HRV and you're in sympathetic dominance, your body's in chronic stress. So there are a lot of tools that you can use that are simple and easy to follow. It just takes looking for those tools online, and they're free and they don't take a lot of work. But I think the biggest thing is sometimes being honest with ourselves and taking a step back and saying, what's creating stress in my life? Am I happy with my relationship? Am I happy with my job? Am I happy with, my non-family relationships? Am I exercising? Am I spending more time eating unhealthy foods or drinking too much? Or do I have habits that are more destructive than helpful? And just do a self-assessment of yourself and then take action on those steps one at a time and just start reducing the stress load. I think that's the best advice we can give. And unfortunately, those are things that, they just require work, and that there's no way of getting around that. You have to put the work in if you want to be healthy. If you don't put the work in, the chances are you're going to be like the vast majority of the American population, which is grossly overweight and unhealthy. And we consume more pharmaceuticals in this country than any other country in the world, and yet we're one of the sickest, most obese countries in the world. So you can't drug yourself healthy. You can't necessarily supplement yourself healthy. It really does come down to modifying your lifestyle factors.
I think that, almost 50% of the patients who come in and see me, it's working on those essentially those foundational things. It just takes a practitioner sometimes telling them that we need to work on these things, and they already know it. They just needed somebody to tell them. So take the advice that we're telling you, work on those things. The other 50%, yes, are going to need specialized testing and, more customized care, but start with those foundational things, because out of every person that comes to see me, we have to make sure that we've done those foundational things, and then we can build upon that.
Mm-hmm. Well, I couldn't agree more. And I can't stress enough, just when you're charting your cycles. So for instance, one thing that came to mind is a lot of women, it's like a hot topic, low progesterone, short luteal phase, premenstrual spotting, signs of low progesterone in the luteal phase, etc., which in some cases can go hand in hand with thyroid dysfunction. And again, all of the things that you're describing, it's so much easier said than done. But one of the things that I'll often say is like, well, try, getting a good amount of sleep and try sleeping in the dark for 30 days, right? And see what happens in your cycles. And so again, for those of you who are charting your cycles and who are concerned about a thyroid issue, when you do these things and actually take them seriously, do your research and start to reduce your chemical exposure, all of those types of things, improve some of these lifestyle factors. The good news is that you can actually see improvements when you're paying attention. One topic, just to shift gears a little bit before we wrap up today, and it's a big topic, so we'll probably just touch on it. But I did want to ask, because a lot of women take birth control at some point in their lives. And, I think we're starting to recognize that the pill and other types of hormonal birth control can have a negative impact on thyroid function. But I don't know that we always think that it could be related. So particularly, for example, women who have recently come off of hormonal birth control and they have symptoms of thyroid dysfunction, and they may think they have a full-blown thyroid disorder, but it may just be that their thyroid is still depressed from when they were using the pill. So I just love to hear you to comment on that and just share with us a little bit about how hormonal birth control can affect thyroid function.
Yeah, I mean, estrogen is really an inhibitor. Estrogen can do a bunch of things. One, it can impact the conversion of thyroid hormone in the cell and trigger that cellular hypothyroidism. But the other thing is that, especially at the gland, when you take estrogen inhibits the absorption of iodine into the body and into the thyroid gland. So when you're taking hormone birth control, what you're essentially doing is reducing the amount of iodine you can get into the thyroid gland and into the body. And if you have less iodine coming into the thyroid gland, then your production of thyroid hormone is going to go down. And so whether that estrogen is impacting the gland or it's increasing the deactivation of enzymes inside the cell, so decreased conversion of T4 to T3, or the added estrogen can cause an elevation of what they call thyroid binding globulin, which is the primary transporter of thyroid hormone in the bloodstream. The higher the level of what they call sex hormone binding globulins or thyroid hormone binding globulin, the less free hormone you're going to have available to get into the cell. So estrogen shuts down glandular production of thyroid hormone. It binds up more of the free hormone, so there's less. So it's three areas. So thyroid gland makes less thyroid hormone. There's less free thyroid hormone in the bloodstream. Therefore, there's less to get into the cell, and it favors the deactivation of thyroid hormone in some of the cells and tissues. So every aspect of thyroid physiology is going to be impacted by birth control.
Not to mention that birth control is extremely inflammatory to the body. It can increase inflammation, and it also depletes a lot of, nutrients, B vitamins, minerals that the body needs to be able to do certain processes, whether it's for thyroid function or sex hormone production or whatever it may be in the body. Your body needs those nutrients, and it often depletes them. So at the cellular level, indirectly, by taking birth control, you're creating a level of inflammation that down the road could contribute to cellular hypothyroidism.
Well, so for the woman who is either currently on birth control and thinking about pregnancy, in the near future, or has recently come off birth control and is listening to this episode because she actually recognized that she may have some symptoms of thyroid issues, one of my questions is it appropriate to actually diagnose a person with a thyroid issue shortly after they've come off birth control? And then kind of like the two-parters. So then the second part of it would be, what are some of the things that you would recommend for a woman who either is on birth control or who has recently come off to support thyroid function?
Well, if a woman is on birth control, the number one thing for me is, why is she on it? And if she's on it just to not get pregnant, then as she comes off of it, she should give herself at least 3 months or more for her hormone physiology to try and reorganize or reestablish itself, and even longer is better. She's going to need and should be taking a prenatal vitamin long before she's pregnant, to make sure she's got all those minerals and nutrients that Dr. Erica said can be depleted. If she's a person who's on birth control because she's had an abnormal cycle, that's a big thing that we have to address, because taking birth control may normalize a bleeding cycle, but it doesn't fix the underlying issue. And so women have been duped into believing that if we give you birth control and it normalizes your bleeding cycle, that we fixed you. And the reality is you haven't fixed anything. All you've done is normalize the bleeding cycle. That is not a normal hormonal cycle. And so once they come off of that, and if their cycle is dysfunctional, and it probably will be for a few months after they come off of it, if it stays abnormal, then we need to really get kind of dig in and say, okay, what's the problem here that's causing the problems in the cycle? What's causing problems with progesterone or estrogen or testosterone that's driving this physiologic problem? And we have to fix the cycle before we should ever have that person trying to get pregnant, or they're really probably going to struggle either getting pregnant or maintaining the pregnancy.
Yeah, and I would also suggest if they're on birth control, that there's nothing wrong with that decision to do that. You definitely want to be taking a good multivitamin, minerals to fill those voids, and then plan it out. If you're planning to come off birth control to get pregnant, you need to plan ahead of time, and don't wait until you can't conceive to make those necessary lifestyle and dietary changes. Go ahead and do them now. Prepare the body, go ahead and get a head start on, because this stuff doesn't happen overnight. This stuff takes time. So preparing the body to come off birth control and for getting pregnant, I think is very, very important, just to kind of plan that out. And I think, you with the tracking your cycle, I think is important. You'd want to do that multiple months before you make that decision that you feel like you're ready to conceive at that point.
Mm-hmm. Well, as we draw our conversation to a close today, which is a shame because I could talk to the two of you all day. But of course, at some point we have to go about our busy lives. We've talked about a lot today. We've covered a lot of ground, and we've given the listeners a lot of information. If there's one thing that you want the listeners to leave with today, what would you say?
I guess the most important thing is, if you don't feel well, right? If you don't, especially when we're talking about fertility, if you're struggling with chronic symptoms, you're struggling to get pregnant, you have abnormal cycles, and you don't feel well, you have to start to look for somebody who's going to look beyond just a couple little lab tests to really understand what's going on with you and help you get well. I think we have this, most of us have insurance, and we expect that the insurance-based treatment is going to provide us with the best outcome. And the reality is, we can't let an insurance company dictate the course of our healthcare, because that's not the goal of the insurance company. So if you're struggling with chronic problems and you're not getting the solution you're looking for, or you feel like you're not being paid attention to, or your voice isn't being heard, you owe it to yourself to find a provider, whether it's in the insurance model, outside the insurance model, who's actually going to listen to you and take the time to help you understand what's wrong. Symptoms are a sign of a problem. They're not something to be masked. They're not something to ignore. They're something that we should be taking a step back as a person's provider and saying, okay, let's help you identify what's causing this, because then we can take the action steps to actually correct the dysfunction, and the symptoms and our signs of problems start to go away without a bunch of medications. Because whether you load your body with more medications or 20 supplements, if you're not getting to the root cause issue and you're not working with the provider who's helping you find the root cause issues, you're never going to get the success that you want or you desire.
And I would say my answer would be for your listeners to have maybe more self-love for themselves and not be so hard on themselves, whether they're having infertility issues or whether it's weight gain, hair issues, skin issues. We often jump to blame ourselves that this is, it's something wrong with me, and we become very insecure and that's more emotional stress. So I think that realizing that there's a cause for everything, and that these symptoms, like Dr. Eric said, is a warning sign. Your body's trying to tell you something. So not being so hard on yourself and having self-love and realizing that there are answers out there. We just have to seek them out, and trying to find the right person to work with, or doing the things that we mentioned in this podcast, I think is a great start.
Mm-hmm. Well, I couldn't think of better words to end on. Dr. Eric and Dr. Erica, thank you so much for coming on the podcast and sharing your wisdom. I know that my listeners are going to really appreciate this episode and really taking a deep dive into thyroid health. Where can the listeners go to find out more about you, to listen to your podcast, and any listeners who happen to be in the area who may be able to work with you directly?
Well, for me, my office is www.rejuvagencenter.com, and they can reach out to me there. Eric and I do the Thyroid Answers podcast, and that's available wherever somebody gets their podcasts. And we I have a number of videos on YouTube and Vimeo on on a whole bunch of different aspects of thyroid physiology. So you can find me there. I'm on Instagram, Facebook. I do have probably this winter or this spring, I'll have a book coming out called The Thyroid Debacle, the undiagnosed epidemic of cellular hypothyroidism. So that should be coming out probably winter or the beginning of the next year. So those are all great ways to learn more about what we do and learn more about me, or if you're interested in working with me. Most of my patients aren't necessarily local to my office. Most of them are patients who are out of my general area, but because of video conferencing and telephone, we can do a lot of that coaching of our patients via what we call telemedicine. So it makes it open to almost everybody. So I'm able to help people in my area, outside my state, and outside the country as well.
And you can find more information about me and my practice at brainandbodyhealthcenter.com. That's our website. You can also find me on Facebook at Brain and Body Health Center, on Instagram and YouTube. We have a ton of informational videos. And just like Dr. Eric, in my practice, we see people in our local area. We're in Winchester, Virginia. So people, travel from the Northern Virginia area, but we also work with people telemedicine-wise as well.
Well, thank you so much. I'll be sure to link everything that you mentioned in the show notes page for the listeners on the go, so they don't have to worry about writing it down. But thank you again for being here. It was just such a treat to have both of you on the show.
Yeah, thanks for having us.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/288. I hope that you enjoyed today's episode with Dr. Eric and Dr. Erica. I hope that you found the episode as informative as I did. Over the years, I've recorded a number of different episodes about thyroid, and I will make sure to link those previous episodes to the show notes page. So head over to fertilityfriday.com/288 for links to previous episodes that we've recorded on thyroid function. What I really appreciated about today's episode is that we were really looking at thyroid disorders from a cellular level and really getting into some of the underlying factors that can disrupt normal thyroid function. And what I really appreciated from the conversation that took place was the holistic approach to thyroid disorders, and to really get away from the idea that there's just one simple solution or one magic supplement that can make everything better, to really understand the function of the thyroid in the body, how it can be affected by a number of different factors, and how healing the thyroid is really a different type of approach. I think it can be quite frustrating for a lot of women who are charting their cycles and start to see signs of thyroid dysfunction, because there's often a lot of different factors involved. It requires us to change our behavior to address factors around stress and diet and sleep and exercise, as well as the nutritional components and specific supplements to support thyroid function. But it often requires us to look at things in a more holistic way to try to figure out how to improve thyroid function. So, of course, just sending a special thank you once again to Dr. Eric and Dr. Erica for coming on the show. And I wanted to let you know that early bird registration is now open for January 2020 Fertility Awareness Mastery. This is my live 10-week group coaching program where we dive into all things fertility awareness, menstrual cycle health, balancing hormone health, optimizing your cycles and your fertility for pregnancy, whether you're trying to conceive now or whether you're planning to conceive in the future and you're wanting to really get into that preconception phase and optimize your cycles before you start to try, or whether you are actively avoiding pregnancy and are really wanting to understand fertility awareness and how you can rely on it as your primary method of birth control. So wherever you are on your fertility awareness journey, there is a spot for you in the group. Early bird registration is open for a limited time that allows you to jump in and join us at the lowest possible price. So make sure to head over to fertilityfriday.com/group program and complete your registration as soon as you can while we still have spots available. So again, that's fertilityfriday.com/group program. And with that said, I want to thank you for spending some time with us today, for joining us, for sharing the podcast with your friends, helping to spread the word about Fertility Friday and fertility awareness. I just want to thank everyone for being part of the Fertility Friday community. And of course, as always, until next time, be well and happy charting.